Hey guys, I want to thank you first for this opportunity to share my work. It's going to be a very exciting time, I think. I'll spend maybe an hour, hour and a half to go over some things. But first, I need to share my screen with my slides. So let's do that. Okay, so I'm going to talk to you about the robust immune system for optimal health. And I need to tell you that I've been there. I have been to the edge of death, and I have obviously succeeded, and I've learned quite a bit. And what I've learned is that our immune system is everything for health. And I think that if you listen to what I say and practice what I am experiencing, and you can experience, you not only can derive a robust immune system for yourself, but also for your patients. So let's talk a little bit about where we're going to go today. I'm going to talk about my story, my experience. I'm going to talk about what I believe is our DNA blueprint, our code that actually has created us, and we need to live by it. There are 9 protocols that I'm going to elaborate on that will specifically produce a robust immune system for yourselves, and 5 individual biomarkers so that you can measure your success and monitor your success as you go forward. And of course, you'll need to embrace and integrate all this information for it to work. So let's get started with my story. And my story is somewhat interesting. So yeah, I'm 74 years old now. So I'm not going to start at the beginning, but let's start at the age of 59. At the age of 59, I had a stroke. Now, I thought I was a healthy guy. I thought I was eating healthy and exercising, but I certainly wasn't. I just didn't realize it. And I had this stroke, and my conventional physicians saved my life. And they put me on 7 medicines for the rest of my life. That didn't really sit well with me. And I decided I needed to figure out what's going on. My doctors said, well, you have to eat a healthy diet and exercise. But what did that really mean? So I started looking at the American Heart Association, the Cancer Society, the Diabetes Association. I tried to figure out what they were telling their people to do to stay healthy and maintain health over the years and get healthy. I incorporated most of the things that they talked about. And let's fast forward from the age of 59 to 66. I was at that time, 59, maybe 187 pounds, on 7 medications. By the time I'm 66, I've lost several pounds, still on 7 medications, and eating and living a lifestyle that was recommended by these major medical organizations. I found a course at the age of 66 at the Kripalu Center for Yoga and Health that talked about very specifically health and nutrition for the healthcare professional. I thought this was a phenomenal opportunity. It was a 5-day course. I took the course and I was amazed. I learned that practically everything I was doing was wrong. I learned about the paleo diet and the paleo lifestyle, and that made complete sense to me. At the end of 5 days, I called my wife. I said, I'm coming home. I'd like to make some changes. So when I got home, she and I bumped heads a little bit, and she gave me 30 days to see how this worked. So we cleared out all the foods that were not paleo, meaning all the foods that were not animal-based products, all the foods that were not in the category of fruits, vegetables, nuts, and seeds. So all the breads and all the legumes and all the processed foods and a whole bunch of stuff were removed from my freezer, my refrigerator, my pantry. And we filled 7 bags of food that we took to the food bank. And we practically had no food. So we started shopping. We went to farmers markets. We started to buy organic. I learned a lot of stuff. We started to prepare our foods. And from the age of 66 to 68, those 2 years, I lost over 35 pounds. And it's not because I was trying to be on a diet. It's just that when you eat healthier, your body's hormones start to balance. And what happens is you lose this extra weight. In addition, I got off of all 7 medications because I didn't need them any longer. That was amazing. And so what I learned was that this way of eating, this way of a lifestyle was beneficial to my health, and it certainly could be beneficial to my patients. So I began to incorporate these concepts into my periodontal therapy. And those patients that had actually started to accept what I had said and done got much, much better periodontal results. And even other chronic diseases started to become better. And they appreciated it. I appreciated it. It's just that a very few percentage of patients really got excited about what I was doing. I started writing, I started lecturing, I started traveling around the country. I started doing virtual consults about my concepts all over the world. And I was asked to speak at the Paleo FX meeting in Austin, Texas in April of 2018. So I am traveling to Austin, Texas from Charleston, South Carolina. And I have to fly through Atlanta Airport, which is a big airport. I like to walk the concourses as long as I have enough time between flights. And I carry a bag on my right shoulder. So I'm carrying this bag on my right shoulder. And as I'm traveling or walking from concourse to concourse, from flight to get to my connecting flight, I'm noticing I'm developing some pain on the right side of my shoulder. And this pain is very unusual. It's like I tore a rotator cuff muscle or ligament or pulled a muscle or something. I get to the meeting, I do my speech, I get back home, and actually the pain is just not going away. So from April 2018 to August of 2018, I am dealing with this discomfort on my right shoulder, and it's going to my back, and then it's going to my chest, and it's difficult to take really deep breaths. And I'm a little pig-headed, and I finally decide in August of 2018, I need to see my doctor. You see, I'm thinking I am the senior poster boy for a healthy lifestyle, and here I am with a torn rotator cuff or something just from a bag that I'm carrying on my shoulder. How ridiculous is that? So I go to my physician, he looks at me, pokes, and he says, yeah, you got some pain here. And I obviously kid around with him. He's the doctor I've seen for over 25 years. And he says, we need to do some tests. So he runs basic tests, blood, CBC, a complete metabolic panel. And then he also includes a C-reactive protein, which looks for systemic inflammation. And he gets the results back and he looks at these results. And the only thing that is really out of line is my C-reactive protein. It basically, normally I run a C-reactive protein of less than 0.5, which is very healthy. This was over 5.5, meaning I have some kind of significant systemic inflammation. It doesn't say if it's chronic or acute, doesn't say where it's coming from, but something systemically is going on. So he orders an MRI. Now, the MRI is actually a very intensive type of test, and it's looking for all kinds of things, soft tissue, and it looks at some of the bone. And the results come back, and he calls me on the phone, and he suggests that I can come into the office or he can just talk over the phone. I said, Bobby, it's not a big deal. Just let's talk over the phone. So he starts to joke around, and he says, did you fall down some steps? Did you get beaten up? I said, of course not. I'm carrying a bag and my arm is getting sore. I tore a ligament or something. And then he gets a little more serious and he says, I see a vertebral compression fracture. I see a series of broken ribs. There's a hairline fracture in your pelvis, and you have a soft tissue mass measuring about 2 centimeters on the side of your spine. Wow. And then he gets very serious and he says, I think you have either leukemia, lymphoma, or multiple myeloma. Oh my God, these are cancers. I am a senior poster boy for a healthy lifestyle, and he's telling me I have some type of cancer. I'm devastated. So he refers me to an oncologist. I don't know the oncologist at this point. We set up the oncology appointment. Before the appointment is scheduled, there are a whole bunch of other tests that are done. A PET scan, which is a big CT scan where they inject radioactive glucose to look for cancer cells. I get a biopsy of the soft tissue mass and just a bunch of things that are done. So I get to the oncology appointment. My wife is there. My 2 adult children are there. And George is a phenomenal guy. As a matter of fact, he's a conventional oncologist and he's my oncologist today. And he tells me, after he shows me all the results and an explanation of what's going on, he tells me that I have IgA kappa, light chain multiple myeloma, with innumerable lytic lesions throughout my spine and the rest of my skeleton. And then he says, this disease is incurable. And then he gives me 3 to 6 months to live if I do nothing at all. Wow. So he says immediately that I need to go ahead and get chemotherapy, and we'll start the next day, because I'm having so much pain in my chest from deep breathing because of the broken ribs. Radiation will not treat any of the cancer, but it will take care of the pain so I can breathe normally. And I'm not a good candidate for stem cell therapy. So I'm looking at my wife and I'm explaining, she knows what I'm thinking, and my oncologist is explaining to me what's going on. And I'm saying, why am I doing this chemotherapy? This ton of bricks has just dropped on my head, and I have to figure out what I need to do. And I'm totally devastated. So I have to figure out some questions to ask George at that moment so I can figure out my next steps. I'm asking, why am I doing chemotherapy if this disease is incurable? And he says, of course, the chemotherapy is going to put me in remission. I'm going to feel much better. And if I feel much better, then I can go along my normal life until the disease comes back. And so I ask, and how am I going to feel as I go through this chemotherapy? And he says, you're going to feel great after you're in remission, but the chemotherapy is going to decrease the quality of your life. But also, when you come out of remission and the disease comes back, we'll need to use another round of chemotherapy, but a more caustic type of chemotherapy because the original wouldn't work. And we would have to do that over and over again. So I'm kind of geeky. And my question then is, so what happens when the chemotherapy doesn't work out? And he says, you're going to die from complications of multiple myeloma. These are pretty deep questions. And I'm asking, well, how am I going to die? And he says that patients that have multiple myeloma, in the end, generally die from an infection that never can be treated because your immune system is so shot, possibly kidney failure because of the malignancy that's affecting the kidney, or you could bleed to death because of the anemia from the malignant cells just destroys the red blood cells, and you will bleed to death. I'm telling him that this isn't making sense to me. And the only thing that matters in my life is the quality of life. I'm not concerned with longevity. I just want quality of life. So I reject chemotherapy. And I talked to George and I explained to George and my wife and my kids that are there, I need to do a lot of investigation. I need to create some type of therapy, unconventional cancer therapy that is going to work for me. I accept the radiation because that's the thing that's going to take care of my pain, and I need to do some investigation. So I start doing a lot of research, and I've developed and created my unconventional cancer protocols. I've tweaked them many, many times from the day I was diagnosed in September 2018 until today. And I'm constantly changing them, and I'm still seeing my original oncologist. So I did very well with these conventional cancer protocols. I'm going to go over these protocols as we go into this little discussion, because these are the methods to support a robust immune system. So I'm doing very well. I'm not getting worse, but I'm not getting better. I'm not going into remission, but my cancer protocols are maintaining a very high quality of life for me. So we'll fast forward to August of 2019. I've now outlived my prognosis. The prognosis was 3 to 6 months to live. My oncologist thought I'd be dead by December 2018. So now it's August of 2019, and I'm standing in my bathroom. I'm actually standing in my bathroom, brushing and flossing my teeth, and I need to throw the dental floss away. Now, I know that my bones are fragile. I know that between my diagnosis in September 2018 and now, I've had a couple pathological fractures because of all the lytic lesions in my bone. It's like a person that has severe osteoporosis. So I know that, but I don't really understand it, I guess. So I'm standing in my bathroom in August, brushing and flossing my teeth, and I'm getting ready to throw the dental floss away. And I twist about 90 degrees to the left where my trash can is. As I twist, my right femur snaps in half and I crash to the floor. When I crash to the floor, I break 2 more ribs, and my right humerus on my right arm fractures in half. I'm literally writhing on the floor in pain, screaming for my wife who's in the other room. And I know things are terrible and I'm ready to die. And I want to die. I know other people that have just had a hip fracture and they die shortly after that. And now I've broken major bones on the entire right side of my body. And I know they're broken because I can see my arm and my leg in angles that obviously I could never twist into. So my wife comes in, she's obviously screaming and crying, and calls the emergency services. They get me to the hospital. They fix my right femur because it's ready, the fracture is ready to perforate the femoral artery and I would bleed to death. They don't fix my right arm. So here's what it looks like. This is my right femur. If you can see the arrows, between the arrows, my right femur literally is snapped in half. And also here's my right humerus as it's snapped in half. Actually, this is an older x-ray after it started to heal with a callus formation that you can see. But my right humerus is snapped in half. It's never reset. And if you look into the bone structure area, the little radiolucent areas all throughout the bone are these lytic lesions. So I'm in pretty bad shape. I am catheterized. I am on narcotic medication, other medicines, and the hospital sends me to hospice hospital to die. I am ready to die. And I want to die. So at the end of August 2019, I'm sent to this hospice hospital to die. While I'm in this hospital, I'm literally bedridden. I am demoralized. I am depressed. I am laying in a bed. Other people that are in hospice are in other rooms. I know that they are dying, and I am waiting to die. Interestingly enough, by the early days of September 2019, a powerful hurricane called Hurricane Dorian is coming to Charleston. It's moving at 1 mile an hour, but it's packing 137-mile-an-hour winds. And this hurricane is going to directly hit the area where the hospice hospital is. So the hospice hospital is actually ordered to evacuate all its patients. They don't know where to send me. My wife's a RN. She scampers to get a hospital bed in the house, and they send me to the house. Now I'm in hospice in my home, catheterized, bedridden, and totally miserable. The hurricane comes through, it goes away, and my wife, this first week or so at home, really gives me some tough love. She says, look, you are a survivor. You're not a victim. You use these cancer protocols that you created, and they did you so well until this terrible accident. Now let's get back on these protocols. Let me get a physical therapist into the house, and let's see if we can work on you and repair you. And of course, I agree, but I'm still bedridden and can't really move and do anything from this bed. I get back on my protocols. The physical therapist comes to the house, and I make a miraculous recovery. He helps me to sit up in bed, eventually get out of bed. The catheter finally comes out after 30 days. I can start walking with a little walker, and I revoke hospice, and I am doing marvelously. These cancer protocols apparently are working for me. And so the next month, October 2019, I'm actually able to get back to see my oncologist. And George is amazed that I'm still alive. And he looks at me and we talk, and he says, well, there's a new immunotherapy drug that the FDA recently approved for this specific cancer of the plasma cells, which is the cancer I have. It's not chemotherapy. It's very specific. It supports the immune system. It helps kill just the plasma cells that are malignant. I get started on that, and I continue to do really well. Let's fast forward to May 2020. My oncologist, George, wants me to get a new PET scan. I had one when I was diagnosed in 2018 that showed lots and lots of cancer cells throughout my skeleton. And then in 2019, I had another one, and it showed the same thing. And this time, May 8th, 2020, I get my third PET scan. The PET scan is done on a Friday evening. My oncologist calls me at home, tells me to make sure my wife gets on speakerphone, and he reads the radiology report, and it says that there are no visible active cancer cells throughout my entire body. That's amazing. I said, George, read that again. Read that again. I wanted to make sure I'm hearing what he is saying, because he's shocked too that there are no visible cancer cells on the PET scan. My wife is crying. She's laughing. She's screaming. I'm elevated 10 inches off the ground, I guess. But when I finally get back to Earth, I realize the PET scan only shows moderate to advanced stages of cancer cells. There could be many cancer cells that are not visible on a PET scan. I get that. I understand that. I am not in remission. But this is the first time the PET scan showed no cancer cells. I still have lots and lots of lytic lesions, but no active cancer cells. And now let's just fast forward to today. I am thriving. I am doing amazingly well. I am not in remission. I do not have a cure for cancer. But what I have learned is that there are methods to support an immune system to make it robust and fight infection. And that's why all of us are alive today. It's because of our immune system. The problem is our immune system today is not as efficient. It's somewhat dysfunctional. It's weakened because of a lot of things that we do, but we can improve it. And that's what I want to talk to you about today. So let's start a little bit about our blueprint, our DNA blueprint. Our DNA blueprint basically is the code that has allowed us to be who we are. It is what we are made from. Now, our DNA blueprint is very interesting. 99%, 99.9% of us You and me are the same. What makes you, you, and me is just 0.1%. So that is telling us that most of us, all of us, have a DNA that is very, very similar. But there are extremes to our DNA. And if you look at this, let's look at the DNA blueprint like a pendulum, going back and forth from one extreme to another. There is an extreme that are things that we must have and that our DNA requires, and there are extremes that we must avoid. We have to follow this DNA blueprint. What is essential? What is off limits? Well, one extreme that is essential is that we must breathe. We must eat. We must drink liquids. And we do that. We don't have any problem doing that. We must breathe to stay alive. We must eat nutritious foods and get nutrients into our body to stay alive. And we must drink liquids to stay alive, or we're dying. So we do these things. But the other extreme is that we cannot consume poisons. The DNA basically says that I am, speaking, the DNA is speaking now, I am not capable of producing specific enzymes to break down specific elements that will damage your body. We'll call these things poisons. And our DNA tells us, don't consume these poisons. But anything and everything in between these extremes is okay. Don't consume these poisons. So what do we do as a human society? We eat and drink these poisons for breakfast, lunch, dinner, and snacks all the time. That's our problem. So I've created these protocols. I've created these protocols, our rules, to get our body into a healthy, robust immune system. We were born as a species to be healthy. Disease today is rampant. The question is why? You know, if you look at the facts from the CDC, the Centers for Disease Control and Prevention, those statistics, which I think are underestimating these problems, show that 60% of the US adult population has some form of chronic disease, and 70% of all deaths in the United States are caused by a chronic disease, and 72% of America is overweight or obese. Chronic disease is a long-term affair. It just doesn't happen all of a sudden. You just don't wake up with high blood pressure that started the day before. You just don't wake up with diabetes that just started. It slowly creates its problems subclinically, eventually until it manifests. Epigenetics is a very interesting concept. Epigenetics is the factors that are in our environment, that surround us, that affect our genome, our genetics, our gene blueprint. The epigenetics are all around us, and our gene code, our genetic code, is within each of our cells. Interestingly, these elements of epigenetics that are surrounding us control the gene expression. It can upregulate and downregulate various genes in our body. So even if we have a genetic predisposition to some bad thing, our actual environment can be altered to correct that. So we have to look, if we're going to look at how we improve our immune system, we have to look at everything. We have to have a very broad perspective. We have to get 35,000 feet above the ground in an airplane to see really what the world is looking like. If we look at our primal ancestors are modern humans from about 160,000 years ago until today. These modern humans have remaining skeletal, we can look at their skeletal remains and see how they lived, what they ate. We can do archaeological digs and find artifacts. We can do some different type of testing, nitrogen testing, to figure out what kind of foods they were eating and what their bodies were actually experiencing. And we can find that there is practically no chronic disease in our primal ancestors. Now, sometimes you could say that they didn't live a long time. Well, those that didn't live a long time, obviously, we have remnants of, but there are many that did live a long time, and we still have those remnants. Primal societies today, and there are only a few that exist in different areas, like, for example, the Hadza in Tanzania, have practically no chronic diseases, and they also do not eat and live the way Western societies live. Something has happened over time. Something has happened, and we can kind of figure out what has happened. And I'm going to go into the details about this in a moment. But if we try to figure out the actual causes of chronic disease, 80% of chronic diseases, and that includes periodontal disease, tooth decay, cancer, and all types of cardiovascular diseases, autoimmune diseases. All of these diseases, these chronic diseases, are factors of metabolic dysfunction and mitochondrial dysfunction. And both of these actually significantly depress the immune system. Only 20% of chronic disease is related and specifically caused by a genetic predisposition. So the bottom line here is that to improve your health, to create optimal health, you need to boost your immune system. You need to make your immune system as robust and efficient and effective as you can. And I have actually created these protocols to boost your immune system. And I've created 9 protocols. I'm going to go over each one of these 9 protocols now. It involves a healthy mouth. It involves a healthy diet, metabolic flexibility, a very healthy and robust gut, individual cells and their mitochondria within cells need to be strengthened. We need to be aware of the sun and what it does for our body and vitamin D. We need to sleep restoratively, exercise efficiently, and certainly we need to reduce stress. I want to go over these with you. So a healthy mouth. If you look at the prevalence of gum disease today, it's kind of interesting and very depressing at the same time. A study has shown, and this study was published, I think, 2010 or something, that 93.9% of the US population has some form of inflammation or gingivitis in the gum tissues. 47% of the US population has periodontitis, and if you're over 65, that prevalence jumps to 70%. These are epidemic numbers. If you look at tooth decay, the World Health Organization has said that tooth decay is one of the most infectious, non-communicable global diseases. 91% of adults aged 20 to 64 has had some form of tooth decay, and 93% of all adults has had dental decay that's over 65 years old. So if we look at the skeletal remains, they tell a very important story. The skeletal remains can be tested with DNA testing, and we can look at the microbial community around the teeth and gums by doing this DNA testing today. And we find that about 20 to 10,000 years ago, those skeletal remains had very, very little tooth decay, very, very little alveolar bone loss. We can see calculus on the root surfaces where obviously dental plaque was, and it was calcified, but there is no significant sign of periodontal disease or tooth decay. But when we look at 10,000 years ago until more recently, there are certain elements, certain changes in the alveolar process and the teeth that show active periodontal disease and active tooth decay. And if we look at skeletal remains from about 170 years ago, all this damage really skyrockets. Something is changing in our species to allow this disease and destruction to occur. If we look at the mouth, we know what the mouth is. The mouth is a mirror to everything that's going on in the body. It is connected to every cell. Every cell communicates with every other cell at some point in time. It is the opening and the portal for the nourishment and food that gets into our body. Obviously, if we're on a good diet or a bad diet, everything starts in the mouth. And you have to look at the mouth, and whatever you put in it, it could be good or it could be bad. There are some interesting studies. There was a study that was done by Dr. Baumgartner in 2009 that was published. It was about the Stone Age diet and gum disease. And what they did, they looked at 10 individuals in Switzerland, and those individuals were in an environment that they had to eat nothing but unprocessed food. They had to hunt and gather for their food. They couldn't eat any westernized foods, and they couldn't brush or floss their teeth for 30 days. The scientists, the investigators evaluated the health of the gum tissue by probing on, looking for bleeding on probing. They took pocket depths. They did bacterial cultures of the tongue and the dental plaque. At the end of the study, in 30 days, they did the same thing. These individuals could not brush or floss for 30 days, but they did not eat any unhealthy processed foods. At the end of 30 days, what was very interesting was that the bleeding on probing significantly improved, the dental plaque significantly increased, but the virulent bacteria actually decreased. In other words, it was a very balanced type of bacteria with much less gingival inflammation over 30 days, even if they didn't brush or floss. Basically, the summary of this study is if you remove all overprocessed foods, then the signs and symptoms of gum disease are reduced. And the bottom line is that the bacteria in dental plaque is healthy if it's balanced and it's not pathogenic. There was another study that was done in 2016 by Dr. Wolber in Germany, and this was a randomized controlled study. He took two groups of people. All of the individuals in the study had gingivitis. They were all eating a very unhealthy diet. He divided the two groups. One group had to eat a healthy diet. They changed the diet. They prepared and provided the food for this group. The other continued to eat their unhealthy diet. Both groups could brush their teeth, but they couldn't floss or use interdental cleaners. They evaluated the inflammation and the pockets. They also evaluated the type of bacteria. From the beginning to the end, the 4-week study showed similar success as Dr. Baumgartner's study. And that was the group that changed their diet to a healthy diet, that could not floss or use any interdental cleaners, had significantly less inflammation and bleeding and less pocketing. And the other group that continued to eat their junky diet had significantly more inflammation and more pocketing. And the study basically says if you're eliminating these free sugars and processed grains that were eliminated in the experimental part of the group, you could, and included anti-inflammatory foods, you could reduce the signs and symptoms of gum disease, and therefore a healthy diet can maintain a healthy dental plaque in a state of balance. There was another study that was done by Scheinman in 2015 that was a meta-analysis study where they looked at all kinds of studies that talked about sugar and tooth decay. And in that study, they showed that dental decay is definitely diet mediated, and healthy plaque becomes unhealthy plaque because something is happening in the system that allows free sugars to start feeding and the decay producing bacteria, the pathogenic bacteria in the unhealthy dental plaque. And this bad bacteria now overgrows, produces acids, and demineralizes the teeth. In other words, sugar is causing tooth decay. The bottom line, get the free sugars out of the diet because that's what's causing the decay. So you need to know, obviously, how to clean your mouth. And I'm just reviewing that to help this unhealthy dental plaque, which I'm going to describe how it gets unhealthy from the state of healthy dental plaque, is to use floss and interdental brushes, brush your gum line, and also clean your tongue. The best way to clean interproximally, you'll floss between the teeth to get the fibers out, but these little TP interproximal cleaners do a phenomenal job in removing the soft, unhealthy dental plaque without disturbing healthy dental plaque underneath and not disturbing the gum tissue at all. When you brush, you're brushing at a 45-degree angle horizontally to remove the soft dental plaque, and you're going to brush your tongue with either a tongue scraper or in this example, an inverted spoon. So as a dentist, you're going to treat these diseases. Let's say this is a potential treatment plan. You're going to treat the acute infection. You want to educate patients. If you're really biologically oriented, you'll possibly get a 3-day food journal to figure out what your patients are eating. You want to remove irritants from the mouth, other dental concerns that are not the acute concerns you're going to start to look at. You're going to teach your patients efficient oral hygiene. And certainly if you are biologically oriented and you understand what I'm talking about today, you're going to start to treat the gut because the gut is critical to the health of the mouth. In addition, you're going to make sure that the occlusal surfaces of the teeth are stable with an occlusal adjustment if necessary. Any other dental issues you're going to correct. If they have advanced periodontitis, you're going to treat them. My recommendation is to use laser therapy because it will regenerate bone. You need to use a 1064 nanometer wavelength laser, the LANAP procedure, laser assisted new attachment procedure from protocol from Millennium Dental is very, very well researched and does a very, very good job. If necessary, you might check for specific pathogens in the mouth. There is a company called Cosmos ID, which is a new company that does whole genome sequencing that I recommend. If you need to do that, you'll obviously you will begin to restore the mouth and certainly develop a preventive protocol to prevent these problems from occurring again. Now, you know what periodontal disease is all about. We're looking at gingivitis. Obviously, it's responding to unhealthy dental plaque and calculus formation. The inflammation in the gum tissue is the obvious sign that there is gingivitis. And then there are signs of periodontitis, which actually starts to break down the bone. Not everybody with gingivitis gets periodontitis, but periodontitis can occur and progress into the bone and cause some destruction. Now, you don't necessarily see periodontitis by the visual inspection, because if you look at this mouth, there is in this arrow, visually doesn't seem very much going on, but if you flap the tissue, all of a sudden you see this huge bone lesion from periodontitis. You're also going to check occlusion. If you have some kind of gritting and grinding of the teeth, as you know, it will rock the teeth on a pivot point. As you rock the teeth, the root moves, the bone starts to break down. This is a radiographic interpretation of how the bone is breaking down from a rocking motion. And of course, the visual sign of grinding could be as severe as this particular individual in the lower arch. Like I said, laser treatment is very effective to regenerate bone. One laser is from Millennium Dental. They use the 1064 nanometer wavelength. Another is the twin light from Photona, uses two different types of wavelengths, the 1064 to regenerate bone and the 2940 nanometer to remove calculus. This is just a picture of some severe periodontal lesions. If you can look at the distal of the last molar, you see a huge bone defect. That you see widened periodontal ligament from rocking of the teeth. You see some calculus. Unfortunately, you see a root canal that's not very well done. And then after, and the periodontal pocket on the distal of the second molar was probing over 10 millimeters. But after Lennap procedure, just less than a year of healing, there's only a 3 millimeter pocket on the distal of that molar as the bone starts to regenerate. So that's the one protocol to get a healthy, robust immune system. You have to have a healthy mouth. And if you don't have a healthy mouth, we're in a profession that is totally capable and competent in making that mouth healthy, especially if we look into the biological aspects. Now, diet is another critical factor. We're talking about a nutrient-dense, anti-inflammatory diet that includes those types of anti-inflammatory nutrient-dense foods. This is not an example of a healthy diet, but this is an example of what an unhealthy diet can do. It's creating metabolic syndrome. Metabolic syndrome is a large waist, high triglycerides, high blood pressure, elevated blood sugars. Insulin doesn't work well, it's resistant, and there are low high density lipoprotein cholesterol readings. A nutrient-dense anti-inflammatory diet provides all of the nutrients the body needs. It will prevent inflammation, especially in the gut. It improves the gut microbiome. It helps the lining of the gut and prevents systemic inflammation and chronic diseases. This is what I recommend. I'm going to go into that in a moment with you. Now, in 2011, the United States Department of Agriculture created this MyPlate. It replaced their food pyramid. And this is what it looks like. But I have some problems with this. For example, it doesn't even describe healthy fats in this MyPlate. It also is talking about too many and even unhealthy grains in the diet, and it's explaining too much dairy in the diet, and it doesn't describe any of the protein sources in a healthy diet. So I don't like this diagram. I don't like what the USDA has described as my plate of food. Healthy diets should exclude anything and everything that includes added sugars and excess carbs. Chemicals from agriculture need to be removed. Obviously, these foods need to be organic. Chemicals like emulsifiers, preservatives, and a variety of other long scientific named elements in the foods, in our processed foods, need to be avoided. Over-processed seed and vegetable oils are very highly very highly loaded with omega-6 fatty acids, and they become rancid, and they're very unhealthy for cell membranes and other necessary metabolic functions for the fat in the body. All processed foods that have all these chemicals need to be avoided, and especially trans fats and a variety of hydrogenated and partially hydrogenated fats. A healthy diet excludes all of these. Healthy diets, on the other hand, are examples of the Mediterranean diet, low carb diet, paleo diet, keto diet, carnivore diet. And actually, I've created my own called the Better Belly Blueprint, which is an animal-based diet with select fruits and vegetables that remove or do not have any high levels or moderate levels of anti-nutrients, as I'm going to explain. But basically, if you compare a standard American diet, which is like burger, fries, and a Coke, any of these diets are healthier than the standard American diet. My Better Belly Blueprint is made up of 70% animal-based foods, 30% plant-based foods, and no anti-nutrients. So 70% or more animal-based foods, 30% or less plant-based foods, and no anti-nutrients. The anti-nutrients consist of phytates, lectins, and oxalates. These are elements that damage the gut microbiome, damage the gut epithelial barrier, bind to minerals, and don't allow these minerals to be absorbed by the body. Trace amounts of these anti-nutrients can be a problem because if you're continuously eating these, they start to accumulate over time. Another element of a diet is actually not eating, it's fasting. And when you fast, here are quite a number of reported benefits in various medical papers that are available on PubMed. Fasting does do quite a bit of healthy things for the body. There are different types of fasting. You could do intermittent fasting, where there's a window of opportunity during the day where you eat, and the majority of the time you're not eating. And then there are multi-day water fasting. Multi-day water fasting, for example, a 48-hour fast, does quite a bit for the body other than intermittent fasting, because it allows all the stored glycogen in the liver to be used up, and it allows the body to go into a state of ketosis, and the liver produces ketones, which is very beneficial to the body, and the bad or unhealthy cells can repair themselves, called autophagy, and it also increases the natural endogenous production of antioxidants. The glutathione is produced in higher concentrations, and it also enhances the diversity of the healthy microbiome in the gut. The third protocol is to get and create metabolic flexibility. We have two fuels in our body that we use for energy. One is carbohydrates. If you have carbohydrates, and you're ingesting carbohydrates, your insulin increases, and the carbs get metabolized and digested. But you can eat too many carbs, you can become addicted to carbs, and all of these addictions of carbs and eating carbs frequently can create and lead to metabolic diseases, as I explained earlier. The other fuel are fats. These fats actually can be metabolized and decrease the level of insulin and allow the body to go into a state of ketosis, where fat is being burned and ketones are being produced by the liver, and free radical production is reduced throughout the body, or excess free radical production is reduced by the body. This metabolic flexibility is very healthy, and you need to experience this on a regular basis. The fats will burn as clean fuels when the body is in ketosis. And when you're out of ketosis and you're eating carbohydrates, the carbohydrates are burned and broken down, and the glucose is used as fuel. When you are in metabolic flexibility and you are able to switch from burning fats to burning glucose and then burning fat again, your immune system strengthens. And the way to be in metabolic flexibility is to eat a diet that allows a ketogenic type of diet that allows you to be in ketosis for maybe 6 days a week, and then cycle out of ketosis 1 day a week by eating enough carbs that throws you out of ketosis, maybe 150 grams of carbs, and allows your body to metabolize just glucose and increase insulin and decrease fat metabolism. To do this cycling, you could increase your carbs by eating raw honey and a variety of fruits and vegetables, especially the ones that are low in phytates, lectins, and oxalates. There are benefits of being of these ketones, and I mentioned it is very healthy for the body. It is not a very good fuel for cancer cells. So it's beneficial for a cancer patient to be in ketosis and have ketones in the body for the majority of the time. They're a clean burning fuel. Also, ketones pass through the blood-brain barrier very easily and can help with brain metabolism and feeds the brain its fuel source 70% of the time. It also improves energy production or AT production from mitochondria. It increases the glutathione production and can even enhance longevity and reduce free radicals. One way to determine if you're in ketosis is to use a ketone breath meter, because this is can identify the ketones that are in the blood and blown off through your exhale from your lungs. The fourth protocol is to have good gut health. This is an example of what the gut lining might look like in the intestines. The top layer is just a bunch of stuff in the lumen, along with all kinds of microbiome. The next layer, the bluish layer, is the mucosal layer that's protective of the epithelial barrier. This epithelial lining is just one cell layer thick. When there is dysbiosis, when there is bad bacteria overgrowing in the gut lumen, it starts to destroy the mucus layer of the gut, penetrating the epithelial barrier, breaking down the epithelial barrier, and leaking into the rest of the body, getting into the bloodstream. This is called a leaky gut, and it creates all kinds of sequelae that eventually create chronic disease. So gut dysbiosis is really a reduction in the beneficial microbes and an overgrowth of all the pathogenic species. And as all this is happening, less and less species are in the gut microbiome. So there's less diversity. The body starts to produce more inflammation, and the immune system is compromised and becomes dysfunctional. There are many irritants that can cause dysbiosis, many irritants, from the foods that we're eating, emotional stress, heavy metals, dirty electromagnetic fields, even exercising, over-exercising, under-exercising, different types of light exposures, especially excessive blue light, not enough sun or not enough vitamin D, poor sleep, a variety of medications, prescription and over-the-counter, including birth control pills, all kinds of low-dose ionizing radiation exposure can damage the microbiome. Even bleaching trays with excess hydrogen peroxide that gets into the blood system as it leaks through the gingival fluids into the bloodstream from trays that are worn every night, or even being swallowed, can create a significant irritant to the gut microbiome. Here's an example of how emotional stress can affect the microbiome, the mouth. This is an individual that came to the office with serious inflammation and hyperplasia of the gingival tissues, but there were no dental causes and no medical reasons that could be identified. Turned out that this woman was being severely abused by her employer, and the psychological and emotional stress really was affecting her. She moved away, left the city, left the employer, came back 4 months later. There was no stress in her life at that time. There was no medical treatment, there was no dental treatment, and her mouth completely cleared up because the stress was eliminated after 4 months. So metabolic endotoxemia is actually this junk that's leaking from the lumen into the bloodstream because the epithelial barrier is breaking down, and it is creating significant inflammation into the bloodstream, and this is called metabolic endotoxemia, and it actually can get into all organ systems throughout the body, causing chronic disease. Even if it's in an extreme state, it can create a cytokine storm, which is quite a serious and life-threatening situation. So we have this vicious cycle that is developing. We have gut dysbiosis because of a variety of irritants to the gut, creating a leaky gut. Periodontal disease is affected by a leaky gut, and actually is one of the causes for of a leaky gut. And then periodontal disease starts to affect the gut. It becomes a vicious cycle back and forth. And then the systemic inflammation goes to other organ systems, creating other diseases, chronic diseases. This is another picture of how this vicious cycle is occurring. So this is looking at the little section of the gut where the cells that are supposedly going to be attached to one another start to break down, called a leaky gut. And this leaky gut or increased intestinal permeability allows the junk to get into the bloodstream, causing chronic inflammation. And periodontal disease and acute inflammation and chronic disease are results of this leaky gut. Periodontal disease is basically where the dental plaque, although it is healthy when it in a healthy state, becomes unhealthy. Dental plaque is healthy until it's not. And it's not healthy because of this dysbiosis in the leaky gut, changes the immune system, compromises the immune system. Lipopolysaccharides and metabolic endotoxemia is affecting all the organ systems, including the mouth. The immune system and the LPS starts to change the bacterial complexion in the dental plaque in the mouth. And poor food choices from unhealthy eating habits start to feed the potentially pathogenic bacteria, and the dental plaque becomes unhealthy dental plaque, and periodontal disease ensues. Now we have two nituses of infection. We have infection in the mouth and we have infection in the gut, and both of these need to be treated. Both of them are working against one another. You cannot treat the mouth without treating the leaky gut, and you cannot treat a leaky gut without treating the mouth. So we need to put all these puzzle pieces together. And one of the amazing things is that the gut epithelial barrier, this lining of the gut, is replaced biologically every 5 to 7 days. If you had been eating a very unhealthy diet and all kinds of irritants to the gut were occurring, but the next day you changed everything and you cleaned up everything, you would have a new gut microbiome within 24 hours. Within 7 days. And what you're eating actually changes the species in the gut within 24 hours. So if you can change your diet and change the irritants in your body, your gut epithelial barrier will regrow, replace itself within a week, and your microbiome can actually change within 24 hours of changing your diet. So, like I said, stop the irritants and your gut lining will repair. So to treat this gut, we need to remove the irritants in the gut, and we have to eat a nutrient-dense diet, which includes fasting. We have to exercise in a healthy way. We want to increase the diversity, quantity, and quality of the gut bacteria and improve this mucus layer that is between the lumen of the gut and the epithelial barrier. And the way to do that, the way I do that with my patients and the way I recommend you do that, is to grow new healthy bacteria. You can do that with spore-based probiotics. Spores are the only probiotics that resist the acid in the stomach, can get into the gut into the gut and begin to germinate, creating a new healthy microbiome. They also produce their own metabolites or biologically active chemicals that enhance the natural microbiome in the body. And all of this enhances your microbiome to grow in numbers, species, and quality and quantity. So a spore-based probiotic is the way to go. I use two. One is Megaspore Biotic, 2 capsules a day. The other is TerraFlora Deep Immune. The Megaspore Biotic is from a company called Microbiome Labs. This is from a company called Enviromedica. And they're both extremely efficient. I use both of these. In addition, vitamin K2 is very beneficial for cellular health. It also is important for ATP production and creating a healthier mitochondria. I use a product called Myomax from Microbiome Labs. There is another product that I use to help support the gut microbiome, and that is immunoglobulins that can eat up the toxic elements, bind to the toxic elements, and get through the lumen out of the body through a bowel movement. These are IgG, IgM, IgA, immunoglobulins that are derived from bovine serum, not from dairy. And it is from Microbiome Labs. It's called Mega IgG 2000. The other protocol I want to talk about is to improve and increase cellular health. Cellular health is the membrane and everything inside of it. That every cell, like I said, speaks to every other cell. We need strong cells. We need strong batteries in cells. The batteries of the cell are called mitochondria to improve this cell membrane, because there are different elements that need to get into the cell. There are different toxic junk byproducts that have to get out of the cell. So the cell membrane has to be healthy. We need to have a means to strengthen that cell membrane. We also need to strengthen and improve the health of the mitochondria inside the cell. These are the batteries of the cell, like a battery of a flashlight. If you turn on a flashlight, the light glows, but if you keep the light on, it starts to weaken because the batteries get weaker. Eventually, the light will go out because the batteries die. The batteries of your cell are the mitochondria. We need to make them and maintain them as healthy as possible. They do self-clean themselves, but we need to do what we can do to make them healthy. There are free radicals that are created because of the energy production inside the cell. We need to have methods that we can reduce the free radical, the excess free radicals that are produced. The body has methods to do that by antioxidant production. The glutathione that's produced in the body does a fine job as long as we have a healthy nutrition. And also, if we don't, then these free radicals can attach and attack other cells. These free radicals can immobilize other cells and become very unhealthy, and those cells cannot function naturally. So to repair the body's cells, there are many methods. Good exercise, especially high intensity interval training, fasting, ketosis will repair the cell membrane and the inner workings of the cell and the mitochondria. In addition, external to all of this is a process or a therapy called pulse electromagnetic field therapy. Pulse electromagnetic field therapy is generation of low frequency waves that are similar to the frequencies of individual cells. And this generation of these low frequency waves do not have any high voltage spikes, so that these are very clean pulse electromagnetic field waves that can help and heal individual cell membranes as well as the mitochondria within the cell. I use a full body mat from PureWave Now that generates these hundreds of waves in a very harmonic pattern, almost like a, if you looked at an oscilloscope, it would look like a philharmonic orchestra of beautiful wave patterns that are in the low frequencies of somewhere in the 10 hertz range up to maybe 10,000 hertz. This full body mat that I use improves the millivoltage potential between the outside and inside of the cell to improve that cell membrane. It also improves the ATP production, the energy production of the mitochondria. There are many documented medical studies that show how pulse electromagnetic field therapy assists bone healing and soft tissue healing, and even it can neutralize the dirty electromagnetic field damage to cells that our environment is producing literally on a daily basis. This is kind of a example, a drawing, a graphic of what a full body mat looks like. It's basically looks like a yoga mat that I put under my bed sheets, and I literally sleep on it. I use it 3 times a day, right before bed, right before waking up in the morning, and during the middle of the day. There are other factors of the protocol. These other six, the other 4 factors that make up my 9 protocols include getting enough adequate sunlight so that we can produce enough vitamin D in our body. We need to have restorative sleep. Circadian rhythm is critical. We need to have efficient exercise. Exercise does help with cellular health and mitochondrial health. And like I said, and I showed you about stress reduction, we need to reduce our stress because it is very, very damaging if it's excess on the mitochondria as well as the entire microbiome in the gut. So I've created these 5 protocols. Again, just a summary, these are the elements that you can incorporate to improve your robust immune system and enhance your patient's robust immune system. And there are tools that I've developed and designed to monitor this. These 5 tools you can utilize to see if your immune system is robust or dysfunctional. 1, any gum bleeding in the mouth is indicative of a dysfunctional immune system. It's compromised. There's no question about it. You need to treat the mouth to prevent periodontal disease, and that actually treats the gut because the gut inflammation, the gut dysbiosis is directly causal to gingival inflammation in the mouth and dysbiosis in the mouth. You must treat the gum bleeding, and you can evaluate it, as I'll show you in a moment, very easily. You want to be able to register the ketones that your body is producing when you're in ketosis. You want a low standard deviation of glycemic variability. This is telling you how your insulin levels are efficiently metabolizing the glucose that's in your body. You want a high alpha diversity of gut microbiome. The gut microbiome needs to be as diverse with as many species and numbers of individual species as possible. And you want a very efficient range of 25 hydroxy vitamin D in your blood. That is extremely beneficial and supportive of an immune system. So gingival bleeding is so easily detected by using a TP brush. You can use a TP interproximal cleaner anywhere between the teeth, especially in the posterior teeth. If you see any signs of bleeding when you're cleaning at the gum line with this little TP brush, even one area, it's a sign of a compromised immune system, because bleeding, the gums should never bleed, bleeding is gingival inflammation and is an indicator of gut dysbiosis. Ketosis can be measured by a ketone meter. This is particular, this one is made by a company called Biosense, and it is registering in units called ACEs, and ACEs should run in this kind of range. 0 to 4 means there's really no significant ketones in your body. 5 to 10, you're in a very, very mild state of ketosis. 11 to 15, moderate ketosis. 16 to 30, high ketosis, and anything over 30 is on the dangerous level. Generally, you want to be at least 5, but average somewhere around 15 per day when you are in ketosis. The glycemic variability can be measured with a glucose, continuous glucose monitor. You can see this little patch on the bottom of my arm. This is a continuous glucose monitor. It actually inserts a little filament into the interstitial tissues that registers the glucose in the interstitial fluid, which is very similar to the glucose in the blood. And it measures it 24 hours a day, 7 days a week. It's utilized for a 2-week period. And this particular device will register the variability of glucose as your body metabolizes it, as well as when you're eating it. And it can show how the glucose spikes and goes down because of your insulin sensitivity or resistance. And the standard deviation, the ups and down movements of this glucose number, it should be as low as possible. And here's a little graph how the glucose monitor shows on an app on the phone how the glucose goes up and down during the day. It never is a straight line. Of course, it changes as you eat, but even when you're not eating, it changes. Even when you're exercising and sleeping, it changes. And that standard deviation is measured and recorded. And if it's higher than 20, you are at an increased risk of chronic disease. If that standard deviation of the glycemic variability is between 14 and 20, it is a goal for a healthy non-diabetic person. And if it's less than 14, that's optimum, and it suggests that your immune system is relatively robust. Alpha diversity can be tested by a test called the Biome FX. It's a new test that's was created by Microbiome Labs. It's read by Cosmos ID, and it identifies this variety of species of different bacteria in your gut microbiome. It's probably one of the most important tests of the gut microbiome you can have, because as you have more and more diverse species, that will crowd out other potentially pathogenic microbes and species of bacteria in your gut. So you're not killing per se specific bacteria that are potentially bad. You're causing your good bacteria to literally overgrow and push out and crowd out the bad guys. This is actually a test that was done on me, and this was on June of 2020. And my gut microbiome is at the 98th percentile. That means 98% of healthy individuals have less diversity than me. That's quite an impressive statement, I think. And that's all due to what I've done to improve my gut microbiome, as I've explained. By the way, my standard deviation of glycemic variability was 10. Less than 14, it was 10, showing that I have a very significant, robust immune system, which I'm very proud of. This is just another picture of the Biome FX test kit. The other test, the other biomarker, is the 25-hydroxy vitamin D blood test. This marker is a critical marker that shows the availability of inactive vitamin D. The 25-hydroxy vitamin D is inactive before it's converted to its active stage. It's the available vitamin D in your blood, and that is significant for many, many functions in the body, especially the immune system. And if your 25-hydroxy vitamin D level is not in the range of 40 nanograms, 40 nanograms to 60 nanograms per milliliter, you need to take vitamin D3 supplementation along with vitamin K2, or you need to be in the sun more. So that's where the sun stimulates vitamin D3 production in the skin that eventually gets converted in the liver to 25-hydroxy vitamin D. What you need to do is to embrace and integrate these 9 protocols. If you're doing that, you're putting the puzzle pieces together. You're using this shotgun approach to really improve the immune system. I can tell you, because like I said, I'm walking the walk and talking the talk. I've been there. I've been to the edge of death. I have literally recovered and I'm thriving today, mainly because I have created a robust immune system in my body. You can do it for yourself. You can do it for your patients. What we're trying to do, our goal, is to get this innate immune system and adaptive immune system ideal, functioning at peak performance. My basic thoughts: you need to learn how to create and maintain your robust immune system by using these 9 protocols that I have described to you in detail. You need to incorporate lifestyle changes. You need to be able to measure and monitor your continued success, not only for yourselves, but with your family, your friends, and your patients. If you need to contact me, I am available at drdanenberg.com. You can email me at al@drdanenberg.com. I respond to all of my emails, maybe in a day or two. So if you have questions, please contact me. I do offer a 12-week coaching program that's based on all of this and more. I also offer just an hour and a half virtual consults. Everything is virtual with Zoom generally today. So these are available from my website. In addition, I have 2 mini books I wrote. One is what's called the Better Belly Blueprint. It's my first mini book. It's on Amazon for download. You can download it to a Kindle device or any Kindle app on your phone or any iPad. I also have my second mini book, which is called Is Your Gut Killing You? And I go into much more detail about what's going on with our diets, our gut microbiome, how it affects periodontal disease, how periodontal disease and the gut work in a vicious cycle, and then how all of this transmits to other organ systems creating chronic disease. So I will stop this slide presentation. I just want to thank you for taking the time. It's been almost an hour and a half. It's a long time. I hope that you got something out of this. This is the way for you and your patients to have a healthy body and healthy wellness going forward. Again, if you have any questions, contact me through my email, and I have much more information on my website. Have a great day. Thanks.